Hi, I'm Steve Hatherly from Roundtable, and I thank you very much for being with us today for what promises to be a really informative and interesting conversation. Today is World Environment Day. It's a day to think about how climate change is affecting lives everywhere, from rising seas to disease outbreaks. It affects everyone around the whole planet. And joining Feifei and I today is someone who's actually doing something about it. Tahomina Sultana is a master's student at Tsinghua University who came from Bangladesh to study environmental engineering. But she's not just a student. She's already built and funded multiple projects back home, including the focus of our chat today, a dengue warning system called the Dengue Prevention Hub. Also, an earthquake alert app, also a household waste management system. Now you put all that together and you would know that she knows how to build tech that saves lives. Thank you so much for being with us today. Feifei, good afternoon to you too.
Good afternoon, Stephen. Good afternoon.
Yeah, Tahomina, it's a pleasure for us to have you with us today. And as I said already, I think this is going to be a really informative conversation about what's going on in Bangladesh, your home country, but also how dengue fever is related there. So thanks for being here.
Thank you so much for inviting me. World Environment Day. It's really honored to speak here, an environment topic on our Environment Day.
We're going to focus our conversation on your app called the Dengue Prevention Hub. But before we get to that, I want to talk about the capital of Bangladesh, Dhaka. As far as I know, it's in the center of the country, and that's the extent of my knowledge. So could you walk us through what a typical summer day would be like in Dhaka?
Okay, that's great. Thank you. Before we drive inside the Dhaka, we need to understand the Bangladesh first. Even though Bangladesh is not a very big country, is a small country, but it's around 173 million people over there. It's a really small country, and inside there, Dhaka is a middle center and is our capital cities also. So most of our country's people, almost too many people are lived inside the Dhaka capital city because they are for work, because of work purposes. That's the center. And summer, when it's coming through there, so people are gathering. So as you know, that summer means sweatings, and then too many people, if gathering some places, definitely we have waste over there, too many. So according to Bangladesh perspective, especially in Dhaka cities, we don't have too many management, like especially waste management and other. People are working there over. So waste, water outside, you can find drainage system that's also not like a proper way. So that's the perfect summer season where they have like dengue and other like seasonal like breakout. So as you know that Bangladesh is for 6 seasons known.
I did not know that. So winter, spring, summer,
yes, and also fall. Yeah, and rainy season.
A rainy season and dry season.
Yes.
I see, okay. So based on what you said then, summertime is the perfect environment, the perfect time for dengue to
breeding around.
Yeah, the dengue mosquitoes to breed and to cause a lot of problems in the city of Dhaka.
Yes.
Tahomina, would you say that people are well informed about what dengue is? I'd like to talk about that for a moment because I've heard of it for myself. I've heard of it before. I kind of know what it is, but I also kind of don't know what it is. Would you say that that's the situation for people in Bangladesh? And maybe you could inform us a little bit about the dangers of dengue fever in general.
Okay, so dengue fever, as you know, that dengue comes from a little insects we call it like mosquitoes. They have the recognitions of black and white stripes on their bodies, and they are quite a little bit larger than the normal dengue, normal mosquitoes around us. But dengues become more and more get major attractions because of people. According to Bangladesh perspective view, summer's coming there, rainy seasons over there, and they have drainage, like granaries. Those are not good enough. So after summer, water over there, waste over there, those are the good place for breeding out for mosquitoes too much. As day by day, mosquitoes are like breeding too much. Inside there also dengue, one of the mosquito, there's also breeding too much. So people, when they get bite mosquito inside there, so the first of that is a normal like fever. They thought it's a seasonal fever that that we actually we have seasonal fever. So they don't
They're
care.
thinking this is nothing. It's going to
nothing
go
at
away in
all.
a couple of days.
Yeah, it's totally different. Like outside all other countries, developed countries, if we have something little with symptoms like fevers or other, we actually try to consult with doctor. So we want to check up first. But in our countries, we technically those are common diseases. We don't go too much hospital over there. So we try to do that at our home, like by myself. For example, fevers, cough. We just take some antibiotics. That's it. It's going to be gone soon. So we need to take rest and take the antibiotics. And okay, the same case happening in Bangladesh also for dengue fever. When they got fever, they thought it's also seasonal normal fever. So they taking the antibiotics, waiting, and after 7 days, 14 days, it's not gone, and it's got worse, more and more. And then finally, when they try to contact with doctor, went to hospital, some of them actually figured out it's a dengue fever. Luckily, they got treatment, few of them, and they might be survived, but most of them are not able to survive because there are less time, and then especially for children, kids, less than 5 years old one, and also like elder people, more than like 50 plus, they don't have much time for recovery themselves. As a result, that silly mosquitoes bite, get their lives.
Tahomina, let's talk about the app, Dengue Prevention Hub. Before we learn how you came up with the app, when did you realize that I think we need to do something about this in Bangladesh, in Dhaka? This is a serious problem. Something needs to be done. I'm going to come up with an idea. Was there a moment that stood out for you?
One of my worker during the work time he's around 60 up, a grandpa. He is working over there, and some 3 days he constantly worked there, and he bring with his we call it paracetamol, is like antibiotic tablets. He took it with him and he worked. And I told him, if you are sick, you need to take a leave for some times. But he said that it's just a normal fever. If I take this medicine, I will get well soon. So I don't need to take a leave for this one. Then after 14 days, it's figured out that he's absent, he's hospitalized, and figured out he got dengue. And then we are taking more than 1 month for recovering him. And thanks God, he recovered and come back to work again. But during that time, I figured out the hospital, they have that seasonal time, too many people over there. It's a longer line. Mothers brought their kids with them for dengue. They have the fever because they don't know that. So they took their kids, and then lots of elder people and similar people also over there. But most of the cases for fever. So it's a huge longer line. So is in our countries almost have 650 public hospital. So huge long line only for fever cases, because they don't know that what happening is 7 days gone, still fever going on. So they are come up here because they're vomiting and other symptoms happening. So I figured out people don't know the general knowledge about dengue. This need to be simple, the simple silly feel like dengue attack. It can be prevented earlier, then we don't need to come up a longer huge line.
Okay, so tell us about the app itself. How does it work? For people in Bangladesh, people in Dhaka, they open up the app. What do they see? How does it help them?
Okay, so it's my apps, that one comes totally different concept of view. So if we are thinking about the apps or something, we must need a smartphone. We need the apps, Google Store, Google Apps or App Store. We need to go and download the apps.
You need a smartphone.
That's my concept is coming from in Bangladesh perspective view. How many people can use that smartphone in country? Most of them are not. Because in our countries, is really rarely people are using the internet. So internet might be available in country but smartphone is not that much, is still not usable. So that's the coming point. So my target was that local people, those who are not able to use those internet too much, don't have the smartphone app capability. So I'm thinking about rather than going Play Store and other store, App Store, you need to download it and then install it, add those, then log in, other stuff. You need to do a lot of things. Instead of that, my my idea is coming from, let's do that web-based version. So people don't need to go like PWA versions. You don't need to go download anything. You can directly go to the website. You can use it like apps, it's online apps, web-based apps. So you can go over there, logging over there if you want. And if you want to use that in your phone, you just easily just put it down on your phone screen. So we developed as an app style. It totally looks like an apps, but you don't need to use your own phone space for using.
So what kind of data feeds into the app then? What's on that website? What's in the app that's helping people?
Okay, so my apps is basically have 4 steps. It's, like totally, if you're thinking about the structure, is work as in four steps. The first one, the lower level, is called communities. So community is basically the people who are going to be involved in there, like general peoples. So they are going to be reporting. So after the reporting system is really super easy, so you don't need to have super knowledge about it. You can easily go real-time GPS system, tracking system. You can easily report in. So reporting system, how this work actually, for example, I do have a lot of water or drainage problem. So user just take a picture over there and upload it, and the places will automatically, we got it, like their according GPS location, we got it. So when they submit their report over there, so they have drainages, we need to do that quickly. So it's got backend. It's already reported, and the user, like it's a third level, so the worker, so they are going to be got the report, and they will check it, the report, how important, how important is it? That this one is happening because of AI system. So when someone is reporting users, so it's AI, our main brain. So it's going to be or give you the percentage about the higher percentage, how risk level. So if that is urgent, need to do that immediately, quick evaluations. So after normal like a worker, after they got the report, they went over there, solve that one, and they need to submit the report after. And that will get back feedback or AI is or their brain. So what happening at that moment, that places. So basically the data like we are using, the local people, those are giving us those on spot real-time informations, and we trained up our models for the general knowledge, because our app is not only just an awareness, just someone is reporting, we are solving. It's not in totally management, it's management and also educated people. So we do also have an AI system, education system. So people, the community people, for example, if I am a community member, I do have a scaling system, like how much I'm participating in that community. So I get my own self a number. So day by day it will increasing. So you can see you can see yourself like how I am involved with my communities. So if you're so it's make you boosting you up to do more and more better.
Yeah, it's encouraging you to take part.
Yeah.
Yeah, it's like being in school when you're a young child, right? You get a kind of reward for participation. It's the same kind of concept here.
But it's also a very complex system. I mean, you're not only building up a very smart system using AI technology, you also need community participation. You also need to have knowledge, for example, about the dengue fever, about the disease itself, and also about the environment around you. I mean, that's also, would you consider it a sort of a challenge when it comes to?
Yes, it's actually technically the prototype is really complicated, but it's it's complicated, not impossible. So everything from my perspective view, if complicated is okay, but if it's possible, if the percentage is lower, but it's still possible, that means we can able to do that one. And because of as we told that, a lot of people not able to go hospital. So because of that, we involved with AI doctors. So how does it work? Is like brain. So people, when they have the fever, symptom fever, they do over there and put out the answers. Like we do have bunches of, we trained our model like that way. So we do have a lot of questions over there. So you just fill up what's your symptoms over there, and it's give you the result that do you have what kind of diseases you might have. So it's dengue or it's a normal fever over there. If it's percentage higher, it's already give you the recommendation what you need to do. If it's sometimes it's higher percentage, then it will definitely suggesting you to go your hospital. But we do have a good structure where you are right now, it give you your nearest location hospital available.
Perfect.
Right? So you can do the schedule over there, directly consultant, like if that only higher emergencies, like risk level is super high, then it's automatically give you the nearest health center hotline numbers. So you directly can talk with the doctors over there. So you don't need to go over there. You can take the preliminary health care during the phone or our systems. So you can take the medical steps first and then further go to the hospital. Don't need to be wait a longer line or don't know what to do.
Alert meaning you're
SMS.
in
Yeah.
Okay.
So if I am a worker, for example, in Dhaka, my worker have different sector. Each sector they are working. So if you are responsible for a sector, then you got if someone is reporting on your A sector, you did directly got in your phone your SMS. Like you have a report, you need to check quickly. So you don't need to be every time check your back end. So is that any kind of report or not? So he can directly check. Okay, I need to do something quickly.
Okay, so that's for the workers. What about for the general public?
The general public, like if something happening, like some areas we figured out this one is higher percentage of dengue fever right now breaking out. So we are already sending back this SMS to give them an like early warning. So these areas involving right now risk percentage. So you need to taking care of it, this area. So each sector, we can send an early warning SMS to them.
Now, here's another challenge I guess might be happening. Could be wrong, but I'm thinking that if you're dealing with, I know, my grandmother and my grandfather, may they rest in peace, but they were very stubborn people. And even if they knew they were sick, going to the hospital would be the last option available. Even if people know, they get the warning, they see the statistic for sector A or what have you, is it difficult to convince people to listen to those messages, to follow those warnings? What kind of feedback are you getting there?
Yeah, that's a really important questions. According to as you told that older peoples and people don't get adapted the technologies. So during we build this, our main target is connected with the people. So they get the AI that we are creating to easier their lives. So AI, basically we're using AI for easier their lives. So when we're people try to first adapting, something, so don't too much give the priorities. They knew it, something happening, it's going to be helping, but still they don't want to involve in it. So we are trying those community. So in our community involvements, that's the percentage. If you do something better, you got the scores. It give you more and more involving. The same thing we are also have in local level. We have booth stops. We do a lot of seminars and a lot of health working types. So involving elder peoples and even inside the key school, we're trying to make a session. So do that. We also did our recent one. We tried to do a tree planting campaign. So inside the tree planting campaign, inside the rural area in Bangladesh, so kids from the school, they are going to tree planting around surrounding areas. And the third one is for elder people. We are going to go with them, food. We provide them food instead of give them food and then talk inside them. So in this kind of apps we have, how they're going to be helpful to them. If we're going to be contribute here, then it's going to be really helpful. And almost currently I have it's still in testing phase. So almost 3 years right now. So after the testing phase, more than 5,000 users right now. Still in
that's the user base right now?
Yeah, it's user base currently for more than 5,000, but it's still in testing phase. We still didn't make it public because one of these dengue fever apps, we still didn't make it public. But during this users, they used it and give us the feedback because we are more welcome their feedbacks. How this is that it really workful for them? So I got really blessing from them. So every time they are try to collaborate with me and they giving really good feedback, but that really usable. So the community persons, they don't think about they're just a user. They also think about the developer of these apps because they're day by day contributing here. Their thoughts are actually whatever they give us, suggesting us, they give feedback. Actually, next time we bring back that idea.
listening to what Tahomina is describing, thinking that's a very detailed and really localized plan, and for three years,
Yes.
right? And now covers 5,000 users. And got me really curious about your journey, from having that idea about, we have this problem in Bangladesh and I need to solve this, to actually launching a website, having workers, involving communities, and also having educational plans on the ground. That's also computer engineering, right? Now at Tsinghua University, you are studying environmental engineering. Are these two somewhat similar, or they're vastly different? And how do you make this connection?
Just science and engineering help you to understand the idea. What is IT? How can you do those things? It's just a normal knowledge, because might be after 3 years, right now is AI really popular right now. So everyone is talking those. You don't need to know about coding. You don't need to anything. Whatever your idea is going to come out. So before that, we need to think about in 2016, 2020, that time. AI is not that much capable, but only the way we can conducting with IT section, we need to know that knowledge. So environment, like computer engineering, computer science will help you to understand the structure about this IT. So all this programming, all those codes, everything. And after I learned that, I know that how to do those stuff, I know that idea. So I need to solve the problem. To understand the problem, I need to go their main core. So I was decided to solving the environment problems. So I decided to let's understand the environment engineering. So it's helped me to understand the current and environment and like our health adaptations, those problems, where those problems actually happening. So I can learn during my study in Tsinghua, I can start learning about them. So I understand what's the problem happening, how we can solve using our my IT knowledge. I can involve inside there, so it can make it more easier. So that's the reason I was thinking about to collaborate both of them together. So give them an user-friendly to other people use.
Yeah, so it's basically sort of at the intersection of technology, computer science, to climate, and maybe some other sectors, for example, in education or in health.
Psychology.
Psychology maybe.
Trying to influence people to accept this new app or this new tech into their lives because it's there to help them. It's just made me realize, and I don't know if I've realized this before, but solving community-based problems needs community communication, of course, but it involves so many things from so many different sectors. And the people who are making the decisions on how to help the community need to understand that there are a lot of different factors at play. And that's why, and we've talked about this on Roundtable before too, why interdisciplinary study at university for young students, you're at a crossroads of your study, how that helped you understand how to create a solution to a problem that you identified within your own community.
And that's also made me think about the reason that seeking solutions. Actually, the story that I know Tahomina is very interesting is because one of her competitions that she pitched this dengue prevention hub project to a competition called the Action Hackathon 2025. And from there, I start to understand, right now, the universities are thinking about, yes, we have great ideas. We have found theory background. But the thing is, our thesis may not be able to solve real-world problems. And that's why this kind of competition is sort of helping you guys, helping young engineers, young climate scientists to actually find real solutions for real-world problems and then connect them to an industry company. For example, I think Tahomina's, some of her projects are also thinking about, you talked about they're getting tested on the ground. So maybe someday in the future, we'll see more similar projects from you in Bangladesh, maybe?
Yeah, definitely. I will try my best. I was always trying to solve. My main focus is for, as you said, that universities are most focused about the knowledge right now. So every year, lots of students go outside, like they got graduated with really good, fascinating ideas. They have a huge problem solution ideas, but it's already all inside the paper. So some of them are just doing the papers over there, publishing paper. So that's it. But they have too many solutions. But those are education life. But our real life, we also have the same problem. Even though they have a lot of papers over there, they have lots of ideas. How do we solve this one? But we really have less people are actually trying to, in real life, solve that problem. So this kind of problem, so we have a lot of competition, hackathon, climate hackathon competitions. Those competition actually helped us. So what kind of ideas, brainstorming ideas we do have, we're trying to test it inside that. So test it, is it actually work or not? So it's helping you to your concept, make it like good day by day. So for example, this idea also coming from the competition I participated. I try to participate a lot of competitions, not even the hackathon, international competition. I also participated huge. The reason I participated, I do have an idea. I have a visionary how to done these things, but I need the feedback from other people. The first, as in students, time. So we don't have too many users. So how can I test it our ideas? So is that actually workable or not? So we try to participate the competitions to test on it and check those already have knowledgeable people. What's their feedback? Is that actually good or not? Is the direction is correct or not? So we participate over there and get their feedback over there. Even though we are not win, like our last case happening, I participated over there. I'm not able to enter the final round, but that project right now got a lot of investment. Why I get this one? Because I'm not able to enter the final round. That's okay. I don't stop over there. I try to come back and then improving my ideas more and more, and then representing once again to them. So after representing them, the investors get attracted. So they're investing on me.
Tahomina Sultana, congratulations. And I said this before we started today, just congratulations on getting this far with your concept, because what you've done is you've designed something that is making a difference to people who need it. It's making a difference in their everyday lives. So you must be at least you should be very, very proud of what you've done so far. So thank you so much for joining Fei and I today on World Environment Day. It was the perfect time to discuss this type of topic too, and hopefully we can come back. And I must apologize, we didn't get to talk about the list of projects that you're working on. We focused on the Dengue Prevention Hub today, but hopefully we can have a chance to speak with you again in the future.
Yeah, definitely, sure. Thank you so much.
Thanks, Fei.
Thank you.
And thank you for watching.
This is CGTN Radio. Hear the difference.